before, because I probably wouldn't be standing here if it hadn't been for the SEIU endorsement back then. And the fact that all these folks sitting here right here, they walked doors for me. They made phone calls for me. They turned out the vote for me. And the reason they did it wasn't just because they thought I was cute. The reason they did it was because we had fought together. We had stood side by side, and we had made sure that folks knew the quality of care that they were getting in hospitals. Together we had fought to raise wages for home care workers in Illinois. Together we had fought to make sure that hospitals weren't making big profits off people who weren't insured. We had worked together, and you had seen that I was willing to stand by your side even when it wasn't politically convenient. Your agenda's been my agenda in the United States Senate. Before debating health care, I talked to Andy Stern and SEIU members. Before immigration debates took place in Washington, I talked with Alcia Medina and SEIU members. Before the EFCA, I talked to SEIU. So we've worked together over these last few years, and I'm proud of what we've done. I'm just not satisfied, because I know how much more we could accomplish as partners in an Obama administration. Just imagine what we could do together. Just imagine what we could do together. Imagine having a president whose life work was your work.
Why is the Service Employees International Union leading the charge in healthcare reform? Well, let's start with Andy Stern, the head of SEIU, who visits the White House once a week. When the president met privately with the healthcare industry, only Stern and one other SEIU official were there representing labor. But why does the SEIU get so much sway with the president? Maybe because their union spent $60 million to help get him elected. Stern says they deployed 100,000 volunteers during the campaign, including 3,000 who worked on the campaign full-time. Their relationship is fostered not only through Stern's close contacts, but in placing members of his union in high posts in the administration. For example, White House political director Patrick Gaspard is a former SEIU executive out of New York. Yet there's one more powerful connection for SEIU. Members of its local chapters share goals and office space with none other than Acorn. SEIU, Acorn, and Obama, branches of the same tree. And that's SEIU in a nutshell.
The public option is not your enemy, it is your friend, I believe. Let me also address an illegitimate concern that's being put forward by those who are claiming that a public option is somehow a Trojan horse for a single-payer system.
My commitment is to make sure that we've got universal health care for all Americans by the end of my first term as president. I would hope that we can set up a system that allows those who can't go through their employer to access a federal system or a state pool of some sort. But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out, or 15 years out, or 20 years out.
I happen to be a proponent of a single-payer universal health care plan. A single-payer health care plan, universal health care plan. That's what I'd like to see.
I think if we get a good public option, it could lead to single payer, and that's the best way to reach single payer.
And next to me was a guy from the insurance company who then argued against the public health insurance option, saying it wouldn't let private insurance compete, that a public option will put the private insurance industry out of business and lead to single payer. My single payer friends,
Nobody is talking about some government takeover of health care. We cannot continue to rely only on our military in order to achieve the national security objectives that we've set. We've got to have a civilian national security force that's just as powerful, just as strong, just as well funded.
You know, when I was asked earlier about the issue of coal, you know, under my plan of a cap and trade system, electricity rates would necessarily skyrocket. Even, you know, regardless of what I say about whether coal is good or bad, because I'm capping greenhouse gases, coal power plants, you know, natural gas, you name it, whatever the plants were, whatever the industry was, they would have to retrofit their operations. That will cost money. They will pass that money on to consumers.
Would you certify that the Arizona border is secure?
If I were asked that question now in this position, first of all, it's an unfair question, and that's why the Board of Governors.
If that is an unfair question, then it would be news to the people of the United States and Arizona. If it's unfair to ask a simple question, is the border secure, then we're never going to have the confidence to get it secure, because it is a fair question, and I'll give you my answer. I don't think it is.
All I'm saying is let's take the example of something like diabetes, one of a disease that's skyrocketing, partly because of obesity, partly because it's not treated as effectively as it could be. Right now, if a family care physician works with his or her patient to help them lose weight, modify diet, monitors whether they're taking their medications in a timely fashion, they might get reimbursed a pittance. But if that same diabetic ends up getting their foot amputated, that's $30,000, $40,000, $50,000. Immediately, the surgeon is reimbursed. Well, why not make sure that we're also reimbursing the care that prevents the amputation, right? That will save us money. You can try to make it really tough on people who look like they, quote unquote, might be illegal immigrants. One of the things that the law says is local officials are allowed to ask somebody who they have a suspicion might be a legal immigrant for their papers. Now suddenly, if you don't have your papers and you took your kid out to get ice cream, you're going to be harassed. That's something that could potentially happen. That's not the right way to go.